this right here, Adam. So the fellows put a few slides just to, make sure that people know a little bit more about who you are and what you do. And that was really an attempt from us. Kai wanted to make sure that we had you in our lecture series. You have joined our faculty meeting already and met a lot of people in our department, but it was important for us to hear some of the updates about resiliency, especially with all the stuff that is going on in our Mayo Clinic globally as well, and how to thrive, of course, during this global pandemic and beyond. This is a challenging question, and we're seeing after a year of being through this pandemic, is beginning to play a very important role in how we do and how we perform. So we are excited to hear about this. Let me tell you a little bit about Dr. Perlman. You can see he obtained his VA in Tufts University, post-bac at Tufts, MD at Boston University, residency in Boston, and then internal medicine and residency at Boston, and then went on to get an MPH, then became in 1998 Director of Integrative Medicine in New Jersey, then went on by also become the medical director at the center, at the Ziegler Center of Integrative Medicine, executive director at the Institute of Complementary and Alternative Medicine in New Jersey, stay in New Jersey all the way up to 2011, and then he went on to 2011 to 2017 to be the executive director of the Duke Integrative Medicine in the healthcare system in North Carolina, and also became the associate vice president of the Wellness Center at Duke, became an associate professor in family medicine at Duke, and then adjunct associate professor of internal medicine at Duke from 2017 and 2018. In 2019, as one of the last endeavors of Dr. Farrugia, remember I was in the a committee to try to recruit Dr. Perlman to come to Mayo, which we accomplished in 2018, and by 2019 he came to join us as a senior associate consultant in internal medicine, Mayo Clinic, Florida. Multiple awards, as you can see. The latest one is the Bravewell Distinguished Service Award, the Academic Consortium for Integrative Medicine and Health, Patient Choice Award. He is recognized in many, many circles, leadership and scholarships and excellence in teaching and patient care. And you can actually see some of the courses. This is one of his many featured publications related to the keynote presentation. And he talks about improvements in resilience and stress and many other things that are important in our profession, of course. And we'll hear more about this. He is an extraordinary, eloquent speaker and also very caring. And of course, because of that and many other reasons, his accomplishments, he is often sought after for many comments and discussions, and especially in today's age where we are changing the way we practice medicine, the way we practice our meetings, as you can see in this platform this morning. So clearly, Adam has done an amazing job. Dr. Perlman has done an amazing job in building bridges between what we do and what the world see us doing, and how our patients and our colleagues perceive us, and how we perceive each other, and how we work with each other. So we're very, very excited to have you, Dr. Perlman. I'm going to go ahead and stop sharing this right here, and I am going to let you share your screen, if you don't mind, so that way we can be ready for your lecture. Take it away, Adam, please.
Great. Thank you very much. As I do the share here, I will say, Dr. Q, not surprisingly, with your department, that was the most memorable intro I've ever had.
The students the fellows put it together. They find it's amazing. They do a beautiful job, and you deserve it, though. It is, I mean, personally, working with you has been an absolute pleasure. And it just, we asked you would come, and you said anytime. You just named the day and date, and as always, just an absolute pleasure. Thank you, Adam.
Well, thank you very much. Unfortunately, my grandmother passed away at 102 a few months ago. Lived a very full life, but I wish she had seen that intro. She would have been proud.
Sorry to hear that, but I'm sure she was very proud of you, and she saw much more of you that we could feature in these few minutes.
So thank you. So everyone can see that okay? That looks right to you on your end, I hope, because I have a presentation mode. So tell me, does that look fine? I think I have to switch the screens, don't I?
Yeah, maybe switch the screen just a little bit. Yeah, because we see it. That's the feature, and then the next one.
So I think I do that this way. Oh, I'm sorry. Just one moment.
Yeah, that's okay. In the meantime, our team did send, and Bruce, I see you're here, but unfortunately we didn't have you on time, Bruce, so I proceeded to do an update. So we're gonna have to re-coordinate with Linda because our time is so tight that I had to, since you weren't here when I started, I had to proceed, and we're gonna have to coordinate with Linda again. I apologize.
That's still not looking correct to you. Is that?
That's still not looking, but you know what, Adam, we can make it work. You don't worry about it. If it's we still have big screens, so we can make it work.
We're resilient here, I guess,
Yes,
right?
exactly.
Multiple times, and I'm not sure why I can't.
That's okay. You don't worry about it. We can still see everything. You're pitching the next move, so that's good.
Okay.
It is right there, sir. Yeah.
That where I switch it right here.
Mhm.
There we go. I knew I could figure it out. All right, I apologize.
Oh, there you go.
Back on, it's you all are used to waking up this early. This is early for us internists, All right. Well, I'm looking forward, as I said, to giving this presentation. I really am honored to be here and presenting to all of you. And it's going to be a little bit different, a little less sort of heavy on the science, a little more, hopefully you will find heavier on some pragmatic things. I would feel that I've been successful if you've taken even one or two things away that you could implement in your own lives. Interestingly, I think I have this correct. This is going to be a bit of a double header here, in that I'm going to present today this presentation, which again is going to be very much more focused on what we can do, what you can do to support yourselves. And then tomorrow morning, I believe I'm back with my administrative partner, Kim McVeigh, and I'll be taking a brief but deeper dive into some of the specific well-being, mental well-being resources that are available. So I think that'll actually segue nicely with.
In that tomorrow is with our leadership and our faculty and a more selected group. So we're going deep into some of the resources that we need for us to be able to help our team.
Great, thank you. Let me talk about so first of all, this is what I'll be speaking with all of you today about. Clearly, stress, the issues of burnout were prevalent. We were all aware of that prior to the pandemic. Certainly, many are residents. I mean, residency in general is a stressful time. A neurosurgical resident, I think, only amplifies that particular stress and the challenges. And although things change when you're sort of out there and finished with training, the need to be able to support ourselves, to handle our reality, has always been there and has only really been amplified by this pandemic that we found ourselves dealing with for the last year plus. The basic fundamental premise of how we deal with all of this, how we deal with life, really hasn't changed. It is about being physically, mentally, and spiritually resilient. I think some of the challenges of how we might adjust our behaviors during this moment have been unique, but there's also an interesting body of literature that suggests that these sort of moments of chaos, if you will, for lack of a better term, also are moments where we can bring about great change and really opportunity for change. That being said, I decided to focus on three main areas over the next 25 minutes or so. Managing our emotions, making time for self-care, and then really wanted to end with this concept of work-life balance. I actually don't have this in my presentation, but I remember reading, maybe it was about a year and a half or so ago, I was looking at some of the literature around burnout. At that point, at least the one paper I was looking at seemed to suggest that neurosurgeons, and I'm going to show you some different data in a minute, but at that point, tended to have a little less burnout than some of the other sort of subspecialties. And the thought was largely driven by a heightened sense of purpose and meaning in their work, but there was significantly less work-life balance and work-life integration. So I wanted to make sure to put some thoughts on that into this presentation. So starting with emotions, and really this concept of emotional radars, and all of you certainly study the brain, but let me share some information from some of our sort of positive psychology colleagues, and actually evolutionary psychologists, which I find quite interesting. So, you know, we have evolved to constantly be scanning our environment, and by and large for threats. And again, you know, just to sort of simplify this, if we were sort of the proverbial cavemen and women walking through the jungle, if you will, and there was a rustling in the bushes, and you thought butterfly as opposed to saber-toothed tiger, you were much less likely to move your genetic material into the next generation. And so again, we've really evolved, the belief is, in a way to default to threats and default to negative emotions at times, fear, whatever the case may be. And certainly for a millennium, that served us quite well. Unfortunately, the threats in today's environment, not that those kind of threats don't exist, I mean, real physical threats or other real threats, more likely and more commonly, it's the text message, it's the email, it's the grant deadline, you know, whatever it might be, that can trigger that sort of a radar and then leave us often experiencing negative emotions kind of in a perpetual way. And so let's talk about a scenario here. And I'll ask you to maybe personalize it for you. You all have different backgrounds. You're sharing some similarity in experience, certainly through the department and your work here at Mayo. But let's imagine, you know, and we've all been working hard, and it's been really tough lately, you know, post-COVID, trying to catch up, a lot of time at the office, had to miss some events. If you have kids, maybe some events with your kids, maybe some events your loved one had wanted you to attend, or just haven't had the time to call your mother as much as you'd like to, or other loved ones. And you get home, and let's imagine you have a loved one at home, maybe it's your spouse, and he or she says, you know, I mean, we talked about the fact that you were going to have a busy life, but this is just over the top. You know, it seems like you're always working. And when you're home, quite frankly, you're doing email, you're on that cell phone, and you just seem really distracted. And I'm just kind of fed up with it. So how might you respond to that kind of interaction? Well, again, based on our emotional radars, you know, we all might have a mix of emotions. Of course, you can feel more than one thing from a particular event, but there's often a predominant, at least initial predominant emotion that you might experience. So let's kind of run through these. I mean, a little hard to tell, but this one right here. So maybe you would feel angry. Now, when you feel a particular emotion, let's say like anger, okay, there is typically a thought, right, that is driving that emotional response. Maybe in the scenario that I've just presented to you, you know, the thought is, I deserve more support. Behind that thought is sort of a triggering value. Okay, we could use different words for this. In the case of anger, very often the trigger is violation of rights. And so, you know, it was interesting. Saturday night, we were with a vaccinated couple that at least one of the few that we can spend time with, sitting outside though. And we were just talking, exchanging some stories, and it was clear there was a whole issue with, believe it or not, my neighbor, some neighbor of his way across the marsh, like hitting golf balls into the marsh, and some of them landing in his yard, and how upset he was. And There's certainly many reasons to be upset about that, but clearly there was a violation of rights being triggered there, right? I have a right to sit in my backyard and not have golf balls shot at my head. But as we talked more, it was clear that, the kind of things that got him triggered were when, in general, he felt his rights were being violated. But let's look at some others. Anxiety, and these are often the two biggies, right? We feel anger or we feel fear or anxiety. So in this case, it might be maybe my work or my relationship will suffer. I've got to do something. This has been too much work and I'm going to have to cut back, and that's going to be a problem. Or, again, this is a problem for my relationships. There, again, we're feeling fear, anxiety. We are often worried about, concerned about a future threat, something that may happen. Maybe you'd feel frustrated. Again, often can feel a mix of emotions. There's nothing I can do. I'm frustrated. I have a lack of resources. I don't really have what I need to be able to handle all of this. Maybe there's sadness. Maybe you think, I thought our relationship was better than this. We had these discussions when we first got together, when I first decided to be a neurosurgeon or work at Mayo, whatever the case may be. So there's a sense of loss. Maybe it's guilt. Certainly a big one for many people. It's interesting, in the literature, often guilt people get in relationships with anger people. There seems to be sort of a balance there that can occur. I've let my family down. I've let my loved ones down. So a violation of others' rights. Maybe you feel embarrassed. They can see I can't manage. What's behind that? A loss of standing. And then one that I think is particularly destructive, and maybe we have a little more time, would go more into, but this sense of shame. And the reason that can be so destructive is the sort of self-judgment that comes with this. A good person should be able to do it all. We'll talk about those should words, need to, should, a little bit in a few minutes when I talk about iceberg beliefs. But often when you catch yourself with that thought, there's judgment. And of course, with shame, there's judgment about ourselves. And it's not about I did something that I feel I shouldn't have or I'm concerned about. It's I'm concerned about who I am and how I'm behaving. And it's really about my own standards. And again, that can be destructive for our mental and ultimately our physical and spiritual health. So one way maybe to think about all of this is through this idea of ABCs. And some of you are probably familiar with this conceptually. Maybe it's been a little while since you've thought about it, but we often have an activating event or a trigger. We often jump right to the consequence. So, I walk in, my wife says that to me, and I immediately perhaps, yell or whatever. I react, hopefully in a way that I would like. It's more of a response, but often there's a reaction there without recognizing that it may have happened in a split second, but there was a belief. And so what do we do about this? Well, first and foremost, we want to be able to recognize what we're experiencing and very often challenge the thought that's behind the emotion. And very often, if we can stop in the moment and challenge that thought, we can choose to respond in a different way. So let's walk through this. So again, I walk in this case, or your case, again, you can personalize it, but let's say a spouse complains about work, how much you've been working. Maybe you respond with, I deserve more support as a thought that quickly flashes, maybe a subconscious thought, but maybe there's, I've let my family down, so I'm feeling anger. Maybe I'm feeling guilt. Maybe I'm feeling both. Again, what we want to try to find is, the ability to respond in that moment in a way consistent with our values. What does that mean? Are you someone who wants to be the person that just sort of, loses their self-control and yells, or are you someone who wants to be thoughtful in your response, recognize that it's been a particularly stressful moment, and maybe there's an opportunity to sit down and have a conversation, and maybe things do need to be reevaluated, right? Of course. And I think we'd all probably agree that we'd like to have a more responsive sort of reaction, if you will. And we also need to recognize that we're human too, and maybe don't always respond the way we like. And that's perhaps where the concept of apologizing comes in as well. So I know one thing that I've found, and perhaps you've found the same, is that it's much easier for me to respond in the moment and not react when I am making an effort to take better care of myself. And again, I'm going to jump into these concepts now, and I want to say that I'm not intending this to be Pollyannish. I fully recognize the stress of this moment, the stress, quite frankly, of the lives that we've all chosen, lives of service, but lives that come with sacrifice. All that being said, at the end of the day, the cell phone doesn't care, and our bodies and minds don't care either. We know that if we don't find ways, our ways of recharging, again, mentally, physically, perhaps even spiritually, things begin to suffer. Our work lives, our professional lives begin to suffer. And ultimately, we know that burnout is one of the destinations when we're not able to really deal with the demands that are being placed on us. This was some fairly recent information that came out during the pandemic, September. This was medical economics, and I would say it's, to me, a little bit misleading. It's quite a high number. This was physicians, although we know from other APPs, nurses, other subspecialties of healthcare providers that the numbers are similar. The one thing to be aware of here is their survey tool tends to prioritize emotional exhaustion, which I think is probably the most prevalent of the burnout sort of symptoms of lack of self-efficacy and cynicism, and then this emotional exhaustion that people have been experiencing. In some more recent data, specifically focused on neurosurgeons, was interesting. It looked like surgeons in general, in line, although a little worse than the general prevalence. Residents, surprisingly to me, and again, there's a lot of literature out there, and so this was one example that was fairly recent, or the most recent I could find, that was focused on neurosurgery, so I wanted to share it with you. I think, the main takeaway is that at any given point, at least, upwards of 50% of our colleagues are feeling burnt out. And, I think about this the way I might think about depression. We all might feel a moment where if we stopped and said, okay, these are kind of the symptoms of depression. If that moment passes very quickly, okay, we've made it through. If that moment starts to stretch out for, weeks, we know it's time, or if we're treating a patient, we know it's time for them to look at something more aggressive in terms of an intervention. And I think burnout is a similar concept. We exist along a continuum. It's sort of a well-being continuum, our physical well-being, our mental well-being. And of course, in any given day, we can be in a different place as it relates to our level of stress. I do want to say here, and again, piggybacking or sort of teeing up for my conversation tomorrow around the specific resources available, that we also know that depression, even thoughts of suicide are serious, have worsened for physicians as they have for many others during this moment. And despite the final bullet there that makes it difficult for all of us, which is a culture that often doesn't invite us to seek professional help, it is important that we do get the help that we need. And that I think we also, and we'll talk more about this tomorrow, we also recognize when our colleagues perhaps need help and reach out to them. I think there are many things here, like work routines and long hours, that we aren't necessarily going to be able to change. I think part of our efforts internally at Mayo are to build efficiencies. This is starting back up through some new rounding that's occurring. Was leadership rounding, and now it's sort of listening and engagement rounds, and there'll be some the pebble in the shoe, how to remove pebbles in the shoe as a part of that rounding process. But at the end of the day, we have to recognize this moment, and as a psychiatrist that I worked with for a number of years at Duke, who taught a lot of mindfulness classes, used to say, I really like this expression he used, was sort of in the midst of this, in the midst of this, can we still find ways to have a better, let's say, maybe work-life balance, recognizing that this is a difficult moment, that we've chosen a challenging career in some levels. And so I found that helpful. It's not trying to deny the difficulty of the moment that we find ourselves in, but in the midst of this, there's still things that we can do. So let's focus in on some of those things a little bit. I want to talk about work-life balance. I certainly didn't come up with this term, but when I first read it in the Harvard Business Review, this idea of work-life integration, it resonated with me. Certainly for you and for us, I would say, this idea of balance with 50-50 is, 50% at home, let's say, perhaps, and 50% at work. I mean, that's just not realistic. And so sometimes thinking about balance can lead us to set ourselves up for failure. And I personally like the concept of integration a little better. But one thing that hit me, and this I did make up, I haven't published anything around it yet, but I'm thinking about it, is that it's more than just how do we integrate or balance our time with all of the demands in our work life and then all the demands in our home life. And one of the things that was left out of that really wonderful and extensive introduction for me is that I also have 5 children, right? And started having children in medical school. So certainly have lived the challenge of work-life balance, work-life integration. And what hit me as I was thinking more about this presentation was, it can lead us to sort of give everything we've got at work and then give everything we've got at home to all those that we love without necessarily taking some of the time for the person that we also need to be loving equally, which is ourselves. And so I wanted to sort of, again, I'll have to trademark this, but a little bit of me, them time as well. And integration is really critical. One of the things that can hold us back from doing that, and I want to recognize that these are some of the beliefs that often drive us to be as successful as, you all are and have been, and for many of you will be in your lives and in your career, are these beliefs about the world that really relate often to perhaps how we were brought up, sort of, again, the values that we were exposed to and that really resonated with us, but that can also pull us, sort of greatest strength, greatest weakness, can pull us to be out of balance or out of integration or sort of to places where we're maybe not necessarily doing what we need to take care of ourselves. So there are achievement icebergs, pushing us to work harder, and we can catch ourselves sometimes, maybe on the drive in or from work, and it maybe for you, you don't word it this way, but being successful is what matters most. Social icebergs. I should always be there for the people I love. So when I can't be there, for my patients, my children, my wife, and my mother and father, maybe I start to feel guilty or shame. Our control icebergs that push at our shortcomings. I should be able to do it all. And because of that, I'm not going to ask for help, or I'm not going to, have a conversation with a mentor or trusted advisor. Despite those beliefs, it's important, right, that we still find ways to not deny those beliefs, to recognize that many aspects of our core beliefs obviously would have driven us to the greatness that we, as I've said, hope to achieve, have achieved, will achieve. But how do we find ways to do that in a way that isn't self-destructive? And so a few kind of tips that, again, were relevant prior to the pandemic. For many of you may be relevant prior to starting your residency or fellowship, but have become only more so with some of the challenges of the pandemic. And first and foremost is sticking to routine. Now, for many of us, I'm not fully aware, and I apologize at the extent of the group listening today. I believe it's more clinician-based. I believe that's what Dr. Q was explaining. So many of you are probably not working from home necessarily the way some of our other colleagues may be. But of course, when you are, you wake up and you're at the office. Although for many of us, you wake up and you're sort of at the office anyways, with the way we're so integrated and connected. And so figuring out a routine where you're scheduling time for self-care, time for time with loved ones, the way you might, your surgical schedule or other aspects of your work routine in life can be particularly important. And literally putting that on the calendar. And I'm sure many of you have found ways to do that, hopefully that works for you. And I'm sure some of you are still struggling. One of the things that I think pulls us off of those routines, and this is one of those, I don't know, maybe aging myself here, those of us on the call that remember the Hair Club for Men ads. I'm not only the president, but I'm also a member. As I present this literature, on monotasking, as much as I read it, I'm like, really? Because, I really find it challenging. But the literature is clear that we get more done, we do it more efficiently when we're being focused on one thing. And I openly admit that this is something that I am still struggling with. But when I can be focused on it, I do feel that. And just getting things done feels a little less hectic to me when I'm not trying to multitask. Now, interestingly, it's the ability to stay focused on one thing. And I'm going to be talking about mindfulness in a moment because it's so critical here. And it's so interesting to do that to a group of, by and large, neurosurgeons, because if anyone has mindfulness innately, and I wonder even just the whole process of training as a neurosurgeon, from my very short exposure, even as a medical student, I mean, if you aren't focused in that moment while you're in that surgical suite, I don't know who is. It's quite intriguing. And of course, we know from some of the literature that when we are distracted, that's when mistakes tend to happen, and including some of this recent literature that got a lot of press, but more because I think it was kind of sexy for the press. This idea that when don't get surgery on a surgeon's birthday, which really was, again, controversial, but more related to the idea that if we're distracted in any way, it certainly can impact on the quality of our work. And that, I think, was the main takeaway, as opposed to the whole birthday message that I think was more of a headline grabber. That being said, we all feel, and when I ask my colleagues and when I give talks like this, and there isn't more of an opportunity for exchange or in smaller groups, one of the predominant things that many are experiencing is this sense of overwhelm, right? We put so much on our plate. So how do we deal with that? Well, I will tell you, I learned this. I've kind of evolved it a little bit over time from an executive coach, leadership coach that I began working with about 10 years ago when I had taken on the role of chair of a department, and I had a bunch of other things going on. I think I had my first R01, and it was just, and I had 5 kids, I think, still at home at that point, and a lot of things I was trying to balance, and I was feeling overwhelmed. And again, long story short, I was able to connect and begin to work with an executive leadership coach. And this small thing I found really transformative for me. Keep my eye on the time here, but and so I'll roll through this. And this idea of sort of delegating, delete, delay, do. And I do this sometimes quickly on every morning. Sometimes it's a good Monday morning thing. Sometimes it's good when I'm just in a moment where I'm saying, okay, what's going on? I'm feeling a little stressed. Okay, I got a lot going on here. What can I delegate? Is there something I can hand off to someone else? And ideally, this supports their self-development. So my MAA is interested in going to medical school. I was working on a presentation. I needed to do some literature review. Hey, maybe he can do that for me. And it's something that he would particularly enjoy since he's interested in the subject matter and wants to go to medical school. Can I delete something or adjust the timeline? Maybe it's a personal thing. I've been trying to get to cleaning the garage for 3 months. And every time I look at that on my to-do list, it just aggravates me that I haven't gotten to it. Maybe it's not important enough. Let me just take it off the list. I don't have to look at it every time and feel like I'm just not able to get to it. Or has happened to me now a few years ago, but was an interesting lesson as I was feeling a lot of guilt about not getting a book chapter back to the editor on time because my co-author wasn't getting her stuff to me. I finally reluctantly, with trepidation, emailed the editor and said, could I please have another 2 weeks? And she said, oh, take another month. No one gets these done on time. So, sometimes you just have to ask and you can adjust the timeline. I think, maybe I should have put this first, but, sometimes it's also, what do I need to do today? What needs to get done right away? What are the priorities, and knock those off first? So, this is a good way to prioritize your day, prioritize your week, and it really can be helpful. Again, if this delegate, delete, delay, do, if there was one takeaway for those of you that are struggling with overwhelm, this is a good one if you can implement it. All right, well, where do we begin as I'm sort of wrapping up, in the next few minutes? I think what we don't want to do is, I hope you feel motivated after this talk and you're like, oh boy, I really have let physical activity go. I'm going to hit the gym for an hour every day now. That's going to be my new thing. Every day I'm going to get up at 3:30 in the morning instead of 4:30, and I'm going to go to the gym. And of course, that might work for a short period of time, but it's probably an overcommitment. And so often it's important to even start with one small step. When I wanted to improve my nutrition, I used to drink my coffee with cream and 3 sugars. And I started, and I didn't really know about this, but I still just sort of luckily, fortunately fell into one small step because I cut it back to 2 sugars. And then 1, and eventually learned to drink it black. But I started with one small step. Now, where do you begin? That can often be a challenge for people. And again, if you were just going to do one small thing coming out of this presentation, very often for many of us, if you're not really sure, if nothing's really coming forward, is there something that could just make you feel a little more energized? Because, we need energy, whether on a micromolecular level or certainly on a macro level. We need the energy just to get anything done. And so, what's one small thing you might be able to do? Maybe it's just stopping checking emails at 7 instead of at 9, or whatever you do. One small thing, and try it out to see how this might allow you to then build. The next talk I'm working on now is one on habits. So, it's interesting, this idea of sort of stacking habits, piggybacking, where if you get one, or you can tie one to the other. A lot of interesting things, but starting with one habit often can lead to more. I'm going to sort of briefly talk about mindfulness, and I've already alluded to it earlier. It can be particularly important. What is it? It's not meditation. It's not relaxation techniques. It's being present. It's as simple as being present. Now, when we think about the concept of mindfulness, it also typically includes being present or paying attention to the present moment in a way that's not judgmental. And I think that's important, because part of what we can become more present to as we cultivate this innate capacity that we all have. And I would wonder, and I haven't looked, I wonder if it has been studied in neurosurgeons. I would imagine probably have it a little more innate, as innate capacity than maybe some others, just because I would imagine hard to do what you all do if you constantly are distracted. But again, it's in a non-judgmental way, because for many, as they begin to strengthen their ability to be present, they also are more present around their own ways of being, and that can lead to judgment if you're not pleased with what you see. What I would say, and I'm, again, curious as you're all sitting listening to this presentation, how much do we use this mindfulness, our ability to be so focused and present while we're maybe in that operating suite in our personal lives? When we're taking that walk on the beach with a loved one, or in a conversation with a child or spouse or friend, is the mind still full, thinking of all we need to do, or are we being mindful in that moment? We all know what it feels like when someone is mindful in front of us. Our patients all know what it's like. They can sense it, even if they can't articulate what that is like, when the doctor is really there versus thinking about whatever the other thought may be that's occupying our mind. So it's a really important concept, not only for our work and our own personal sense of well-being, but for our relationships. Large body of literature, certainly from an NIH perspective, under the office within NIH, the institute that studies complementary and integrative medicine, mindfulness has been the most funded, most studied. There are a number of mental and emotional benefits, including reduced rumination, this idea of mind wandering. Again, I alluded earlier, fear, worrying about future threat. Anger can often also be thinking about what happened in the past, maybe remembering that conversation with that spouse and getting pissed off about it, quite frankly. Yet there's nothing, we can't go back, right? If we're still upset, then we can engage in a conversation. But this mind wandering often causes undue suffering. So again, this is something that can be cultivated. It can be cultivated formally or informally, right? So formally is certainly through ways that have been utilized and studied over hundreds of years, thousands of years, excuse me, like meditation or progressive relaxation, but more informal, decide to be present in this moment. And of course, if that's challenging for you or you're interested, but you want to take a next step, there's also a number of apps which can help with this. And so let me end by saying that I'm going to end with a little bit of a different concept. Part of what I often add into this talk, and I had to shorten it a little bit from the 50 minutes to 30 minutes, was a concept on post-traumatic growth. How do we really emerge having grown from the trauma, quite frankly, of this moment? A moment that challenges our beliefs about the world, perhaps, and the way we thought things were going to be. And we're doing that on individual levels. We're doing that as an institution, really as a profession. How does medicine evolve and grow? I mean, certainly telehealth would be one example. But in the literature on post-traumatic growth, study out of Korea in particular, but there's been others, and I'm referencing, but that's, but it really talked about gratitude as being the antidote. And what does that mean? In the midst of this, in the midst of a challenging minute or moment, challenging week, month, maybe a challenging year like we've all experienced, being able to focus on those things that you can still feel thankful for. For me, maybe the fact that, my 5 kids were home with me for 3 months for the first time in 8 years. And my oldest left 8 years ago for college, 8 or 9 years now. And, they were stuck with us for 3 months. And that was a lot of toilet paper and paper towels during a very challenging time to get that stuff. But it was also a wonderful time to be together. So I'm going to end with that thought. And again, thank you so much for inviting me here. And I think we have a few moments for questions.
Dr. Perlman, that was a beautiful, beautiful talk. And I think that I see a lot of comments in the chat that were asking if we recorded. I hope you don't mind. We did record it. And it is amazing because it's so necessary. We're going through very turbulent times. So I open it for questions and comments, please.
Oh, should I look at the chat here too? I'll look at the chat.
Yes, I'm looking at the chat. Gabriel, go ahead.
No, thank you very much, Dr. Quiñones and Dr. Perlman, for that excellent presentation that involve many aspects of our lives, not only as a neurosurgeon, but as a person, as a human beings. And of course, you have reason in many things. And many times we as a neurosurgeons are the people that don't follow that one thing at a time. We always are doing in our minds and doing in our business many things at the same time. Of course, we need to learn how to do one thing at a time and pay attention not only for our work but our family. And so, thank you very much for give us many of the aspects that we are passing day by day, and we are not paying enough attention. Thank you very much.
Adam, just so you know, Dr. Vargas is all the way from Bucaramanga, Colombia. We have a lot of people who connect from different parts of the world, and this is a universal problem. Everything that you mentioned today, and I think that Gabriel mentions, instead of being mindful, I think that our minds are constantly full of information, of stimulation, and we are worried in so many different ways, as you said, in our profession in medicine in general.
Can I make
Please,
a little comment?
Ana Carrano is one of our faculty, junior faculty, Dr. Perlman. Go ahead, Ana.
Well, thank you very much for the beautiful talk, Dr. Perlman. There's something that you didn't really mention, and then I feel like I struggle the most during this pandemic time. It's like being socially isolated, and especially not be able to see my family. Most of us are from foreign countries, so we'll be stuck in the United States and for a long time.
Yes, so. Adam, please.
Yeah, and Anna, thank you for bringing that up, and you're right. I mean, there certainly so much I could have put into this talk, but that particular point, I mean, I've actually been saying, and I'm thinking about writing some sort of opinion piece where I just have the title of it right now. And the title is The Perfect Storm of Disconnection. We've really experienced a perfect storm of disconnection, right? I mean, not only have we not been able to see very often loved ones because we haven't been able to travel and be with them physically. Very often when we are with people, we have, these masks on, and we're not able to hug or connect in ways that we normally could have. And that's been particularly destabilizing. I mean, it's enhanced for many of us a sense of loneliness. There is several really interesting studies out there that look at loneliness in particular. And again, prior to the pandemic, it was, one might say, a bit of an epidemic in this country. 40% of people experienced loneliness on a regular basis when surveyed. And loneliness, I found this so fascinating. Loneliness is equivalent to smoking 15 cigarettes a day as it relates to morbidity and mortality. And so, Anna, you're very correct. It's been very challenging. And I guess, to be honest, we've all tried to make the best of technology, but it isn't the same. This is not the same as if we were in the same room, looking at each other and smiling and feeling each other's reactions. It's just not the same. And obviously we need to do our best in this moment. And, in the midst of this, find ways to connect as best we can. And thank goodness, recognize that the light is at the end of the tunnel with, the vaccinations and hopefully being able to connect with, and of course, for many have lost loved ones as well during this moment. That's also particularly challenging. So, a very, very important issue that you brought up.
Yeah, thank you. Hopefully soon we'll be all reunited with our loved ones.
Thank you, Anna. Linda, you had a question right there in the chat for Dr. Perlman. Go ahead, Linda, please.
Thank you, Dr. Perlman. Great talk again. I've heard this a few times, and it's just very validating to continue to hear, and just the comments about being mindful and trying to focus on one thing at a time. I think it is challenging for a lot of us, either if you're physicians or allied health staff. Would you mind just kind of sharing a little bit about the resources again for staff? Sometimes people might not be sure of where to go or who to call.
Sure. So again, I didn't fully follow Dr. Q, who will be on for the presentation tomorrow morning. And so I wasn't sure if you were saying it was a broader group or it's a more narrow group. And I say that only because we'll go narrow. Okay, so what I'll also do is, with Dr. Q's permission, we can share, and you're welcome to send that to the entire department, some resources following that presentation. And there is an FLA Wellbeing at mayo.edu email that you can use to inquire. But there are a number of, and of course, there is a wellbeing website on the intranet that you can access that will have the resources that are available there. More specifically, I see Dr. Freeman. You may have seen in the Officers and Counselors newsletter that with David's leadership, there is a sort of contact list that's going to be that you can share, like text to a friend, and you can put in your contacts. It has many of the important phone numbers from EAP to other employee well-being resources that I believe, if I read the newsletter correctly, there's going to be some efforts even within the coastal room to have people sort of be able to sign up for that. What I'll be speaking about with my colleague Kim McVeigh tomorrow is an enterprise initiative called HELP, Healing the Emotional Lives of Peers, which was developed and piloted in the anesthesia department in Rochester and now is being rolled out enterprise-wide. And that is really, and as you'll hear tomorrow, there will be an appeal to have, at least if there isn't already, 2 or 3 colleagues trained within the department that can then do these activations. It's really recognizing that very often the second victim phenomenon occurs when we have an event. And so this is a program to more formally address that. I'll also sort of, again, not to ruin all the punchlines for tomorrow, but on an enterprise level, there is a mental health task force that's been put together. I'm actually representing Florida, so I can just tell you a few things there quickly. One is that there is an external website that's being developed, because if you've ever tried to access any of this from home, any of the resources from home, obviously, if you're not on the intranet, that can be challenging. So that will be hopefully announced shortly. And for those that may be struggling, or if you have family members who may be struggling and need more professional care, in addition to obviously the internal resources, the psychologists and psychiatrists, the network outside of Mayo was quite limited. And the system has recognized that. And so they're expanding the network. In fact, already, I don't know if it's been officially announced, but I know it's already been implemented that any tier 3, let's say you needed to see a psychologist, any tier 3, which technically is sort of out of network, is going to be handled as tier 2. This was my understanding, obviously. Check with the business office or whatnot for clarification, but that was my understanding, which obviously leads to enhanced reimbursement for those services. So, so there are a lot of resources out there. I think the challenge is we often don't know how to connect with them. The intranet website is probably the easiest. But let me also, because I know I'm going to need to wrap up, let me also put, if I could, myself out there and just say that confidentially, and I've had some colleagues do this of all sorts, please feel free to either reach out to me or suggest that to a colleague or anyone. Again, it's, typical Mayo, Perlman.adam@Mayo email. Again, we have the Florida Wellbeing email that is another way to get connected and resources. But I'm more than happy to be that initial point person and try to connect people with what they need. And maybe I'll stop there because that's like a whole nother presentation, like I said.
Thank you, Adam. Wonderful. One last question. I saw Dr. Fossey had his hand up, and I want to make sure that we give him a chance. He's thought a lot about these topics, actually, about well-being, especially with the residents or fellows and people. Go ahead, Chris.
Thanks, Q. Thank you, Dr. Perlman. That was an excellent talk. We haven't had an opportunity to meet yet. I've only been here for just less than a year, but before being here, I was at UF in Gainesville and had a leadership role in the residency. And one of the things we did was start a wellness program, a formal wellness program for neurosurgery residents, which, as you would imagine, is fairly novel in our field. And it was met with quite a bit of snickering at the beginning and lots of jokes about how this isn't neurosurgery and things like that. And interestingly, about half the residents really got into it and the other half remained that way. And I think, we all have different perspectives, of course, and our perspectives are a little bit different after we've been in the cockpit for a while and seen some of the things that can go wrong that you don't anticipate on the beginning end of the career. But I was just curious on your thoughts, how has that been sort of in other specialties or in internal medicine? Do you have any tips for ways to just kind of incrementally change the culture? Because I think that's one of the big things we face in neurosurgery. That's a problem with these concepts, that honestly, there's tons of literature that show that all this stuff is very important. It works really well. And it makes for more balanced people and better doctors, but there's still much resistance in certain places.
Yeah, certainly. And it's great to meet you virtually and maybe hopefully in person in the near future. Because it's an ongoing conversation, right? That it's not like, it's more of a process as opposed to a destination, right? Or an outcome. It's something that will need continual work. I think just a couple of quick comments, because I know we're short on time. One is, again, these iceberg beliefs that drive us to much of the greatness that have driven all of us to where we find ourselves. They have a dark side to them. obviously, or can have a dark side, including, not allowing us to ask for help, all the things that I was alluding to earlier. And we certainly have to recognize that. That being said, to be honest, I think one of the most important things we can do is lead by example, to be very honest with you. And I think that our younger colleagues pick up on those cues. They see how we are behaving, and in that regard, I think it's important to openly share. Just like I used to let my kids see me going to the gym with the gym bag, to sort of model that behavior. I don't know how much you engage in conversations, formally and informally, around the ways that when I say you, I mean, the faculty there, the more senior consultants, senior associate consultants, actually engage in those conversations. I mean, certainly you're talking plenty about epidural abscesses, understandably, but do you have those conversations on a personal level around what you do to find your balance, to maintain your relationships on your personal lives, to self-care? That's probably a great place to begin, and a great way to begin to shift that culture.
And the challenge, of course, is when we are battling mental illness, most of humanity, the first reaction is to isolate even further. And it is up to the rest of us to see how we can gather around, our colleagues to try to help, as you said. And I saw that part of your presentation as well, Adam, which I think is a very important message. So, well, Adam, thank you. We'll see you tomorrow morning. We'll talk some other details and faculty. And we think this is very important to us. And I think that a lot of the people, you can see how many people in several of the rooms, there were many people joining. And if it's okay with you, we can share your video also for some of the different groups that were not able to join us this morning. But it's important that they hear these techniques, these talks, and for all of us to try to implement them better. We all can learn. This is one of those topics we cannot learn enough. So we thank you immensely. We see you tomorrow. Have a wonderful day and a wonderful week, everybody. And thank you for joining us this morning, and looking forward for a great week. All righty. Thank you, Adam. Take care, Dr. Perlman. Bye-bye.